Hello, I'm Tiffany. I have been a certified surgical technologist for 7 years, and I'm going to talk to you about the possibilities that you have for careers after graduating. So, does anyone know where you can work as a surgical tech after you graduate? You have a lot more options than you really think that you do. So, I'm going to discuss those with you. According to the U.S. Bureau of Labor Stats, in 2014, there were 99,800 surgical tech jobs. That's a lot. And the expected growth between 2014 and 2024 was 14,700. That's a 15% growth. So the surgical tech's jobs are not a dying career. It's a growing career. There's more and more jobs being added every day with hospital expansions and more surgeons. There's just a lot of growth within the healthcare facility as well as with surgical technologists. In 2016, the median pay overall was $45,160 per year. Now, this includes your new grads as well as your experienced techs. So, this is just an average overall of how much a year techs get paid. And 70% of the surgical technologists who graduate end up working in a hospital. So, this could be because they don't know the other options, or it could be because that's where they want to be or the first place that they actually found a job at. So there's a wide variety of reasons that is a 70%. Jobs in Ohio, estimated there are 4,050 surgical techs. In West Virginia, there are 890 surgical techs. And in Kentucky, there is about 1,800 surgical techs. And the annual wages for those, with Ohio, it's $42,060 a year. West Virginia is a little bit lower at $37,930, and Kentucky was the highest in the tri-state area with $42,140 a year as annual salaries for surgical techs. And again, those are from new grads all the way through experienced. And in U.S. news, surgical tech unemployment rate is 1.4%. That 1.4% could be because graduates don't apply for jobs, decide they don't like it, work in other careers, or it could be because hospitals are having difficulty. The smaller rural hospitals, those small little community hospitals sometimes have fewer patients and they may lay off. Surgical techs ranked number 23 in the best healthcare support jobs. So I thought that was pretty neat. And again, that could be because there's not as many surgical techs versus RNs who done that survey when they got those numbers. So it could be a low number because of that, or it could actually be an actual overall. And the best paying state is California. However, when looking at that, you really need to also look at the cost of living, because the more a cost of living city or state is, the higher they have to make their wages. So therefore, yes, that is the highest paying state in America, but it also could be because they're not taking in consideration of the cost of living out there too. So places you can work according to the Association of Surgical Technology, as well as some job search engines that I looked up, including Indeed.com, company websites, Monster, and then some personal experience, because being a surgical tech for 7 years, I've worked with a wide variety of surgical technologists in different settings and fields. Some of them have went on to further their career, so I'm going to talk about all of that. So there is a possibility of up to 8 areas in the hospital that you can actually work as a surgical technologist. So the biggest and largest is the operating room. That's where the majority of surgical end up working after graduating. Some hospitals have an endoscopy unit separate from the operating room. So, again, that's another area that a surgical tech can work at. Some surgical techs decide that they don't like surgery. They don't want to be involved in the patient care, but they don't want their degree to go to waste. So they end up working in central sterile SPD. With that, they clean instruments, they put instrument sets together, they do the case carts for the surgeries for the next day. And then they can also be SPD managers who are over the SPD techs. And they work more with policies and procedures and making sure everything runs smoothly. So that's two options there. Another one is labor and delivery units. Surgery scheduling, which is a great asset to the OR to have a surgical tech as a scheduler, because they already know the procedures. They already know the surgeons. Chances are they've already worked in the operating room there. So they know the basics of what to put on the schedule and what we're going to need. So that's a great asset to have. A lot of the surgery schedulers are older surgical techs who just don't want to stand for hours anymore, and they would rather have a job where they can sit down at a desk and work at kind of a slower pace. So they decide, instead of doing something else and wasting their degree, to do surgery scheduling. Another one that is a good one is material management. So I worked with a lady who was a surgical technologist, already knew all the supplies, the sales reps. She was already in contact with them. So she decided to take the materials management position, which is another asset to the OR, considering they already know what the surgeon's like, what's being used. So that's a great asset to have too. And the cardiovascular OR, some hospitals have that, and they hire surgical techs there as well. Some other places are surgery centers, and those can be surgeon investor owned, where a group of surgeons come in together and they build or buy a surgery center, and it is ran by surgeons. Or it can also be a hospital owned. And some examples of both of those are eye surgery centers, orthopedic surgery centers, endoscopy surgery centers, plastic surgery centers, and a lot of times those are found in larger cities. So you can just know the difference and know kind of what to look for when you're searching for a job. Doctors' offices also hire surgical techs, and this is not really something that's talked about a whole lot. You just kind of have to go on their website or the hospital or clinic's website and find out what is hiring and which surgeons are hiring surgical techs for the office, because they do some minor procedures in office where they do have a surgical tech. And those would be examples: urology, plastic surgery, orthopedic surgery, dental surgery, and endoscopy surgery, which a good example of the endoscopy is HIMG. They have a group of surgeons who do procedures in the clinic, and that's all they do in the clinic endoscopy suite is just endo procedures that are their surgeons there. So that's a good example of that. Does anybody know what a private scrub is? Okay, a private scrub is a surgical tech that can work with one surgeon or a group of surgeons in a certain specialty. And sometimes these are hired through the hospital, and oftentimes they're hired through the surgeon's office. And with that, you work with that surgeon or group of surgeons. You're there from the time that they start till the time that they finish, unless they let you go home before then, and a lot of times you are on call with that surgeon. So if that surgeon's working at 3 o'clock in the morning, you're at the hospital working at 3 o'clock in the morning with that surgeon. They don't call on anybody else. You're that surgeon's private scrub. So some other ones are organ, tissue, and eye retrieval teams. These are usually worked on an on-call basis through a company, and you fly all over to retrieve organs when someone has passed away and are an organ donor. You can also work in a vet's office. A lot of people don't know that. Some vets hire surgical techs. You can be a traveling surgical tech, but a traveling surgical tech usually requires 1 to 3 years of experience. And this is just so that you can walk into a place and not have to have any orientation. So a surgical tech traveler walks in, picks up, and does the job usually for a 13-week period. That's usually what most contracts are. You can travel nationally or you can travel just within the U.S. So because our certification is nationally certified, it lets us work outside of the United States. And they also have specialty traveling scrubs techs, and that is cardiovascular, orthopedics. Sometimes they have trauma travelers and vascular travelers. Some sales reps jobs will hire just a surgical tech. They don't have to have an associate or a bachelor degree. Teaching and precepting. Some places will hire surgical techs to teach the surgical tech program or precept the surgical tech students. And you can always continue your education. You have options. You can go direct to school for your first assistant, and this allows you to do more of the surgery. This allows you to close wounds. It allows you to help the surgeon more and be more in depth of a surgical tech. So those are usually about 3 to 5 weeks long. You have to go somewhere and sit for that long in class learning the material before you are allowed to sit for the national boards for your first assist. You can also go back and get your associate degree and become the director of a surgical tech program or a sales rep, and a bachelor degree and the same thing, sales rep or director of the surgical tech program. So, does anybody have any questions? Okay, I just want you guys to know that the possibilities for a successful career are endless with surgical tech. Decide what is best for you and what you really want to do. You can go far in this. Be willing to learn. It is a career that is always changing, always advancing. Always be willing and eager to learn, and you will go far in this. So, good luck.